So if you get confused with the anatomical positions and how we can have directional terms in human anatomy, this video is going to make it super simple. So to start with, we have the standard anatomical position, which is facing forwards, a neutral face, no smiling, anything like that. We have palms forward, arms adjacent to the side of feet, shoulder width apart. So we're going to begin with superior and inferior. So what this looks like is where I've drawn these arrows here. We say superior is above and inferior is below. And the way I like to remember this is if you think superior, I like to think something better than. So if we think like a hierarchy, maybe is higher up and inferior is not as good as it's below. And I'm just drawing a little face on this person here because obviously it's a neutral face. So for an example, we can say the hand here is superior to the foot because it's above it. And we can say that the foot as well is inferior to the hand or the head in both ways. So it basically, why we use it is to make it easier for us to say where the position of something is on the body. So a nice little example here is in our face, we have the nasal cavity, which we would say is superior to the larynx, which is this structure just below here. And the same way we can say the larynx is actually inferior to the nasal cavity. So I'm going to look at what's anterior versus posterior. So anterior is what we say anything in front of the body, and we say posterior is anything behind the body. And I like to think posterior sounds like posture, so you know your back. And that makes it really simple to remember that posterior is the back and then everything else is forwards, anterior. So a nice little example here is of a photograph I took of a sacrum. So we can say this is the anterior face of a sacrum, and that changes the naming because we now have anterior sacral foramina. Instead we have here a posterior photograph of the sacrum, and instead the naming changes to posterior sacral foramina, so it does change the naming that we use. Let's now look at lateral versus medial. So I'm going to go ahead here and draw a line down the middle of our person and say this is the middle line. Makes it super simple. And we say either side of this is going to be lateral, further away from the middle line. And anything towards that middle line is then going to become medial. That makes it really simple. And then if you think medial sounds very much like middle, so that's the way I like to remember it. Anything close to the middle becomes medial. A little example here, so this hand, we would say the lateral to the leg, and the leg is medial to the hand, so it's close to the middle part. So a little example here, we can say that the right and left lungs at the top here are lateral, and the heart in the middle is medial, of course. So think now, what is proximal versus distal? So this can be a little bit tricky. So we're going to say, we're going to split the person here into what we call the axial skeleton, which is essentially the trunk, the head, that part, and then we're going to call everything else, so the arms, the legs, the limbs, essentially, are then going to become the appendicular skeleton. And this is very important for naming things that are proximal versus distal. So what we're going to say is the distance from the axial skeleton is how we name things, proximal or distal. So here where I've labelled, we can say the shoulder is proximal because it's close to the axial skeleton, and the hand, however, is distal because it is further away from the axial skeleton. Again, here we can say the knee is proximal because it is close to the axial, then the foot, and the foot therefore is distal because it's further away. But do not get mixed up because this can be a little bit confusing when we've just looked at superior and inferior. So it's very important to remember that this is talking about the distance from the axial skeleton, and it's not quite the same as superior and inferior, so don't get mixed up with it if you can. So we're now going to have a little look at superficial versus deep. So this is quite an interesting one. So what I'm going to draw here is a simple line. We're going to call this skin. So this can be the skin surface of your arm, for example, and then we're going to have body is like further in on the left, and on the right side we're going to have the outside, and where I've scribbled down here we're going to call this superficial as it's close to the skin, and anything further away into the body we're going to call it deep. Now an example here would be that the sternum, which is the bone that will go over the front of your heart. Okay, so that's superficial because it's close to the skin, and we say the heart is deep as it's further away. So hopefully that makes it really, really simple, and let me know if there's any troubles you've got.